Okay, today I'm going to talk about some things to consider should you ever find yourself engaged in counseling with a client who identifies as a Black mom. Let me preface this conversation by saying that, as always, we do not want to make any assumptions about who our clients are based on how they look or how they present. I am a Black mom, and so I'm going to discuss today things that I would like a therapist to consider when working with me. Okay. There are a few topics that I will address in more detail today. First, the perception and treatment of mental health in the Black community in general. Second, the construct of the strong Black woman schema and how that may impact your work with a Black mom in therapy. Thirdly, the impact of second wave feminism and how that may also influence your work with a Black mom. And lastly, I'll offer some potential cautions and possible therapeutic approaches to consider with this population. But first, a caveat. So for the sake of this presentation, I am narrowly defining the term Black. And what I mean by Black in this context is a person, in this case a mom, who presents with brown skin, textured hair, and is a descendant of African slaves in the United States. Now, my reason for making this distinction is because I want to honor the fact that Black folks in this country have a myriad of cultural experiences and upbringings. I'll use my sister-in-law as an example, as she presents and identifies herself as a Black woman. However, as a woman born in this country to Haitian immigrants, her experience of discrimination is quite different from my own. And that's because of her first-generation status. Additionally, in my opinion, it is a different feeling to be Black in America while also having firm roots to your ancestors. In my sister-in-law's case, she has strong ties to the lands, languages, and culture of her Haitian people. This, as she puts it, gives her a sense of self and groundedness in who she is. Now, for her, while this may not be true for other first-gen Black folks that come from other parts of the diaspora, the Haitian people take a lot of pride in their revolt and victory over their French colonial rule. And that fact colors the way these folks understand themselves as strong, competent people. That sense of self may be difficult for Black descendants of slaves to capture, meaning I do not know personally the lands, languages, and customs of my ancestors. Thus, much of my sense of Blackness is deeply tied with my African Americanness, which is a sordid and traumatic history to say the least, and that ties into the topic of intergenerational trauma that I'll discuss later. Okay, how is mental health viewed? Mental health is a tricky kind of subject in the Black community, I would say, in general. It has been my experience that psychological well-being is not necessarily a priority in raising children in generations past. Now, that is not to say that Black moms do not want their children to grow up to be happy and healthy, well functioning adults. It's just to say that mental health, in the past at least, has seemed to be an abstract and unimportant idea. Now, what was most important in the past was a child's physical well being, of course. One example that kind of highlights this idea is the advice that I received after I had my first son. He was 2 weeks old at the time, and he began to cry. And an elder of mine calmly told me, "Don't pick that baby up when he cries. He's fed and he's dry, and he doesn't need anything from you." And this is really well-meaning advice, but it misses the importance of what we know about the psychological necessity of attachment and parental attunement to a child's needs and psychological well-being. Another issue that has affected the Black community's openness to mental health is the overall distrust Black folks traditionally have in the medical establishment and with authorities, especially if those authorities are members of the dominant group. Now, we have discussed in the past the case of Henrietta Lacks and the case of the Tuskegee syphilis, and things like that certainly play a role in Black folks' distrust of the system, but it's also important to note that the dominant culture's ideas of what it means to be sane could be different than what is considered quote unquote sane in the Black community. Black church is a really good example of this. Something like catching the Holy Ghost or speaking in tongues can look to a white person like that churchgoer is crazy and needs to be institutionalized. However, such acts of religious devotion and expression are embraced as normal in the Black community. Finally, on this point, especially as I speak to older Black moms, oftentimes they don't see the point to talking about their problems. The question is like, what is that going to do? And those are really good questions. However, if we look at Black moms' mental health concerns from a trauma lens, and I'll talk more about that later, and what we know about that, we know that talk therapy is actually not sufficient in treating trauma. So my mother-in-laws, they might have a genuine concern that is accurate when they say that talking about their problems is not an effective treatment. Okay, so how are Black folks diagnosing mental illness? Well, I asked a few Black moms from the generation before me to tell me how mental illness was explained in their time. And here is a list of some of the terms that they remembered. I think it's interesting to note the last term, weak-minded. For me, that speaks very deeply to the experiences of marginalized peoples, and that our bodies are often the target of violence that we don't have very much control over. But our minds are our own. And so for you to have a mental break or a mental illness, it might be considered a sign of weakness. Okay. So the last Black community idea about mental health I'll address is surrounding suicide. Not only has killing yourself traditionally been seen as a sign of weakness, but also something that can bring a lot of shame to the victim's family. My mother remembers this statement that her uncle used to say to his kids. He would say, "If you kill yourself, I'm going to kill you." Obviously, this statement makes no logical sense, but it speaks to the idea that you better not do anything that embarrasses me as your parent or embarrasses your family. Okay, so how is mental health treated traditionally in the Black community? I will say that if you don't acknowledge a thing, you can't treat it. While we are in this space on this presentation talking about mental health and mental illness, um, if a person doesn't view this topic as an illness or a health issue, then that person won't treat it medically, right? So again, mental illness has traditionally been seen in the Black community as a sign of weakness in some cases. So there may be folks that may have wanted some help, but decided not to pursue that help because they didn't want to be viewed as weak. Additionally, just like other physical or social issues that arise in the Black community, historically, religious-based interventions like prayer are also common. Okay, so now I'm going to switch gears to more practical application and talk about some concepts that may impact our clinical work with Black moms. The first concept I'd like to introduce is this idea of the strong Black woman schema. The strong Black woman schema is a culturally specific mindset that many Black women have developed as a means to cope with and resist the oppressive systems that they live in. This construct is characterized by emotional suppression, self-reliance, and caregiving. While this schema has been demonstrated to be a great source of hope, I should say, and resilience for Black women, it also has some negative aspects that, in my opinion, get exacerbated when a Black woman becomes a parent. So how might you work with a Black mom who identifies with this cultural schema? Well, for one, you might have some pushback or some reluctance from a Black mom to engage in emotional exploration or even find the utility in engaging in emotional topics. So remember that this schema is characterized by emotional suppression, which has served a great protective function and making sure that this woman is able to do what she needs to do to take care of her family, to take care of her community and herself. And for a therapist to suggest that this woman needs to tap into and reflect on her deeply suppressed emotions is to potentially call up a lot of strong feelings that we as clinicians have to be ready to hold space for and to assure that our client feels safe enough in engaging in those emotions. Additionally, because the strong Black woman schema emphasizes self-reliance, it might be a challenge to even get this woman into your office in the first place. Consider the source of your referral for your clients. So, if a Black mom is reaching out to you as a matter of choice, then she might be more ready and willing to do this kind of work. However, if she is mandated in any way, either by the courts or by a partner who is wanting her to work on her mental health, then the idea of receiving your help may not be what she wants to do. Also consider this idea of self-reliance as you encourage this population to seek social support as well as other types of support like childcare. She may feel that this kind of support seeking is a sign of weakness. This also ties into the strong Black woman schema ideas around caregiving. So traditionally, Black women have been superhuman caregivers in their community, not only taking care of their own children, but oftentimes taking care of other people's children in the community. They're often tasked with caring for their elders as well as their partners. However, this mindset doesn't leave a lot of room for this woman to take care of herself. So making suggestions about self-care when, as a mother, she has other humans to care for may be a tough sell. You might need to do a lot of psychoeducation as well as reframing this woman's idea of what self-care is and what it could look like for her in her life. Okay, so let's talk a bit about second wave feminism because I believe it has had a bit of an impact on this particular population. One of the things that my mother used to say was that she was not a feminist because she was Black. And I never understood this comment until I learned a little bit more about what second wave feminism was all about. And it turns out that my mother was coming of age during this particular movement, which emphasized women and mothers unchaining from their stoves and getting out into the workforce with equal pay and equal opportunity and expanding childcare for them to do so. However, Black mothers historically have always worked and thus, for the most part, never had the privilege to just kind of only be a mom or only be a wife and stay at home. So the idea that most Black moms, for many economic reasons, have had to have jobs outside of the home adds a layer of identity that might not be present for white moms. And that is to say that a Black mom may have some deep negative feelings about not working, about being a stay-at-home mom, for example, because it might feel countercultural. I'll share that I have 3 children and I have never not worked and I have never had a maternity leave. It was kind of a cultural expectation that having a baby or 3 does not eliminate your ability to earn your own money. And the work might turn into part-time work, gig work, contract work, but nonetheless, the notion is that you are to find work that allows you to juggle the demands of parenting. In essence, work is a part of many Black moms' identity, and leaving your child with strangers even while you work may have some taboos associated with it as well. I alluded to the necessity of Black moms working, and of course, some of that necessity is due to social economic factors. Historically, slaves didn't get maternity leave, so mothers had to wear their babies in the field. Contemporarily, the wages of Black moms' partners may not have been enough to cover household expenses, or due to other social political reasons, many Black moms may find themselves in single households and so have to work. So those are some other reasons. Okay. So I want to briefly discuss one caution that is, and that's attempting to engage Black moms, particularly those who identify with this strong Black woman schema in mindfulness or embodiment-based therapeutic work. I will share that I am actually a really huge proponent of this kind of work, and I've taught yoga and practiced yoga for many years. However, for Black women and mothers, their bodies have historically been have not really historically been what I would call a safe place, meaning Black women have a documented history in this country of being raped by their masters, being forced to engage in literally back-breaking labor, and their bodies have been objectified and used as wet nurses to feed other people's children. While these harsh and stressful traumatic experiences may not have occurred in the lifetime of the modern Black mom that walks into your office, it is important to understand the potential impact of intergenerational trauma that may be influencing the way this woman presents to you. In short, intergenerational trauma is defined as the transmission of the oppressive or traumatic effect of a historical event. In this case, events, plural. So asking a Black mother to tune into or become aware of sensations in her body may open up a whole lot of negative emotion and even physical discomfort that you or she may not be ready for. So I would encourage to move slowly and to always move with permission. Okay. With that said, I will offer some recommendations for therapeutic approaches. My bias is towards a person centered approach for a few reasons. First, empathic listening is incredibly validating for a group who historically presents with three salient marginalized identity. That is, she is Black, she is a woman, and she is a mother. Second, allowing the session to be client focused or client directed and egalitarian allows your office to be a space that she has autonomy and agency when in many other places in her life she might not have that. Finally, the emphasis on therapist congruence and authenticity is so important. The more you can be yourself with any client, the more that client will likely trust you. But particularly for a group that has had to maintain a level of distrust of the dominant group just to survive, just to keep her kids alive, it's super important that her therapist be real, right? To be their self, to say what they know and what they don't know, and be willing to learn and be open-minded. This goes a long way to allowing this woman to kind of appreciate and trust you as a therapist. All right. Thank you for listening, and here are my references.